Welcome to the Community Health Hero Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Seems like the last school bell just rang and kids are getting ready to enjoy their long summer break. When in the blink of an eye, it's time to get ready to go back to school. Today on Community Health Heroes, we'll be talking back to school and what you can do to keep your kids healthy for the start of the school year and throughout. Today on Community Health Heroes, we'll be speaking with Dr. Carl Robertson, a pediatrician from Children's Hospital New Orleans, who'll be discussing the variety of topics related to children's health, and then Lindsay Kataya, the author of local mommy blog, Crawfish Tales. Lindsay will share some of her back-to-school experiences with getting ready for her baby crawfish to go back to school. You don't want to miss the important information we have to share with you today, so don't go away.
Getting closer to nature can get you closer to your family.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. This first pitch is fouled into the back.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Joining us today to help explain how you can make sure your kids are physically and emotionally healthy as they return to school and throughout their school year is Dr. Carl Robinson, a pediatrician at Children's Hospital New Orleans. Welcome to the show, Dr. Robertson. Well, thank you for joining us, Dr. Robinson. I'd like to ask you a couple questions. How do parents prepare for their child's annual visit to see their pediatrician?
Well, I think most parents, especially at preschool, at the school level, the kids actually look forward to coming to the pediatrician. But I think a lot of it is a matter of talking and explaining. I think nowadays we need to be a little more frank with the children. This is what's going to happen. These are the sorts of things that we expect to happen. And please don't give me too much hell.
What would you recommend the parents bring to the doctor's appointment?
Well, they definitely need any health records that they have, especially the vaccination records. The more medical information you bring the doctor, the better off he is, or he or she will be in terms of dealing with the problems that may occur or may be potential problems that will occur.
Okay, well that's really good information. So bring their immunization records and maybe if they went and saw another doctor in between seeing you, any specialist forms or anything like that?
Exactly, any specialist forms. And any releases that they need at the school.
Like for sports,
For
physical?
sports or any other activities.
That's really good information. And kind of switching gears a little bit, how do the parents know what vaccines their child should be getting or already had and the space in between them?
If you had asked that 5 years ago, I would have said, oh, we have to look this up and blah, blah, blah. But now you can go on the internet and get from almost any source. The American Academy of Pediatrics, for example, has a nice source for parents to get all of a complete list of the vaccines that are there.
And then the parents can be more prepared to tell their child they're going to get one or two immunizations.
Exactly, and it makes for better conversation with the pediatrician. When the parents walk in loaded with information, then the pediatrician steps back and looks and says, oh, I need to talk to these people a little more.
Yeah, no, that's very good information. And then what do the parents need to know about vision exams? When they come in, do you usually do an annual vision exam on a
It
child?
depends upon the age, but most kids, after they've passed 3 or 4, need to see an optometrist or an ophthalmologist to get a comprehensive vision exam.
Okay, so you can do a basic screening exam as a pediatrician, but when you need something more detailed, you might refer them out.
Exactly, and in fact, I do refer most of them out. I think that by the preschool, by the time they're 4 or 5 years old, they need to have had a comprehensive vision exam.
And then there's a lot of things that we can see as physicians in the vision in the back of the eye.
Exactly.
You can see like what kind of diseases can you detect from looking in an eye?
Well, you can get any problems with the retina. You can see the problems that we run into are kids who are farsighted and kids who are nearsighted, and those are problems that need to be seen by the ophthalmologist or the optometrist.
Absolutely. So you would refer them to an optometrist or an ophthalmologist.
Exactly.
What kind of things do the parents come in complaining of when their child is having visual problems?
Well, they run into walls, they run into toys, they're sitting too close to the television. And those are the sorts of things that most parents recognize. It's just like those parents whose children have hearing problems. They're sitting right up on the television, or they're like husbands. They don't hear anything. So that's the sort of thing that we look for. We look for general things that parents are going to give us, information that they give us that we need to be aware of.
Absolutely. Kids are carrying these massive backpacks nowadays. I mean, I see kids that they look like suitcases. Are there any kind of guidelines for how big the backpack should be or how much it should weigh?
I usually talk about a 10% weight, and 10% of the child's weight. I usually will tell parents, have the child to leave the books at school, and that solves the problem. They can bring one book home in a backpack, because we started seeing more and more problems with children's musculature and backs as they started bringing these huge backpacks with these huge books at home. And so the schools probably will make an arrangement where the homework, the book can come home, or whatever book can come home, but the children really don't need to roll all of those books home. The other thing is that they can do the rollers, if
roller
they can
bags.
get roller packs, if the schools will allow them.
Do they sometimes come to you for a note saying that please allow this child to carry a roller bag?
Exactly, and most pediatricians will give that.
And I also saw more books are online, so that's helping relieve that backpack problem.
Absolutely.
A lot of the schools are going to a book in the classroom, but then online books for their children at home.
Absolutely.
So that's a really good idea. Anything else a parent should do to prepare their child for the school year?
I think that the big deal at school is bullying.
Oh, okay.
And I think that one of the things that we especially as they get in the 2nd, 3rd, or 4th grade,
that's really early, 2nd grade.
We're beginning to see problems, and the older they get, the more problems we get. And so parents need to have a conversation or more conversations with their children in terms of not, if they are bullies and they know it, because most parents know, with their children to not bully, and with the others who are usually just regular kids, to stand up and look at the person in the eye and say, I'm not going to do this, or I'm not going to, you shouldn't talk to me that way, and then walk away. Learn how to walk away from those types of behaviors. And so a lot of this can be avoided. And then the schools need to be aware. The children are going to come home, and some of them will tell their parents. Hopefully, most of them will. And if they don't, then they will. That effect will be seen in terms of the child not wanting to go to school, or the child having dirty clothes more than usual from being pushed or whatever. And so the parents need to go to school and participate in the process at that point.
So those are some of the signs and symptoms a parent could look for, like
Yeah.
ripped or torn clothes,
Exactly.
dirty clothes, child really not wanting to go to school for no particular reason.
Exactly.
Okay.
And most people know their children. They know that they are not, the ones that are aggressive, they know who they are. The ones that are not aggressive, they know who they are too. And so
That's very good
they
information.
know the behaviors of their children.
We're going to take a short break and we'll be back with more from Dr. Robinson, so stay tuned to Community Health Heroes.
Don't look at me. Your hair's a bit frizzy today. Oh, you should pick that up. Oh, you're such a dork. Loser. Here, let me help you with that. Oops.
Every day, kids witness bullying.
Oh, look. Your crush is looking at you. Poor you.
They want to help, but don't know how.
See, no one here's gonna help you, because no one...
Teach your kids how to be more than a bystander. Visit stopbullying.gov.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer.
Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
We're back with more from Dr. Carl Robinson, a pediatrician at Children's Hospital, New Orleans. So let's kind of switch gears a little bit again and talk about school lunches. What should parents know about school lunches, and especially if a child has allergies?
Well, depending upon the allergy, certainly a note needs to go with the child. If, say it's peanut allergy, no peanuts in the diet. Gluten, if it's a gluten-free diet that the child needs to have. Most schools will accommodate parents with an appropriate note from either the nutritionist or from their doctor, or from both. And so a parent needs to be aware of that, and the child needs to be aware of most of the allergies that they have.
So that they know what they're allergic to.
So they know what they can't eat.
And even like the teacher for like school parties, the teacher should probably know what
Yeah.
allergies the children have.
Yeah, those notes should be, a note should be given to the teacher and to the principal and to the nutritional people at school.
What if they have a milk allergy? Are schools offering alternative choices?
Yeah, there are alternative choices to it, and most children, it's really kind of interesting. These allergies are few and far between, but they do have them, and so parents may sometimes even send in substitutes for their children.
So that if the school doesn't offer choices, they can either pack their own lunch or bring part of their lunch with them.
Exactly.
Okay. Kids are doing a lot of sports nowadays at earlier and earlier ages. What do you recommend for an age when a child should join a sport?
I'm really not one of those people who pushes early sports. I think early non-contact sports is good. I think because number one, we don't have enough exercise in the school system for most children, for any children as far as I'm concerned. The 1 hour sports and activity sessions are no longer present. But I think contact sports should be limited to those children who are in the upper grades. Now that may go against what a lot of football parents like, but we see injuries we see knee injuries, we see sprains, we see problems that occur in 6, 7, 8-year-old children that should not be there. So my feeling is that when you get one, you shouldn't have any. And even though many people feel that with the padding and stuff that we use nowadays, we can avoid that. My feeling is that the bones are not fully developed, and they still will not develop until years later, but especially in the elementary school period. And so why should we put a child through that? I'm on the minority side. Many parents will go against that. Most of them want their children to be football stars and basketball stars at young ages. I would prefer them running track and running the yard and doing non-contact activities.
So non-contact when they're in their elementary years, and then moving into more contact sports when they're maybe in the middle school or high school.
Exactly, because they'll be in much better shape physically and mentally, and they will not have suffered through injury, because many of these injuries go through life.
So besides sprains and strains and knee injuries, what other injuries do you see children
You see
receiving?
ankle injuries, you see bones breaking, and occasionally you'll see a concussion or some head trauma that a child will have, especially in those little football games that some of the kids play.
And even practice.
And even practicing.
Mm-hmm.
Yeah.
Well, what parting advice can you give parents to prepare their kid for the upcoming school year?
Take it easy. Get excited. He or she is going to be out of the house. Get all of your information together, and go down the first day and make sure everything's settled and it's what you expect. But make sure you've had all your immunizations together. Make sure you've had your medical questions together, and your child and have been resolved before you take that child in. In New Orleans, I find that people tend to go late, take their children late to school. Take those children on time. When school starts, the first day every child should be there. And I noticed that, and it's a phenomenon that I've never seen before, except here. And so take those children in with all the information that you can get. And get those children into that month or so before is a time to turn the TV down. That's the other thing, limit TV to 1 or 2 hours a day, 1 to 2 hours a day, preferably an hour a day, and start conditioning the child to sleeping earlier.
Go to bed at a reasonable time?
That's correct.
Mm-hmm. So they can get up early and be at school?
So they can get up early and be at school. So all of you can get up early and be at school. Yeah.
Well, thank you, Dr. Robinson. This has been just incredible information to help parents get their kids ready for school.
Thank you.
Thank you so much for joining us, Dr. Robinson. We really appreciate you sharing this important information with our community. We'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Okay.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, no!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
Here today to discuss back to school through a mommy's eyes is Lindsay Kutaya. Thank you for joining us today,
Thanks for
Lindsay.
having me.
So you have a child that's almost 3 years old?
Almost 3 years old, yes, getting ready for school to start.
And how do you go about that as a parent?
I think there's a lot that happens from getting uniforms fitted to getting the school supplies off the checklist to learning about the school and what they need from you as you get started. It's a lot of research that goes in, and also just asking moms who have children older than you, what are some recommendations and tips to get started.
So what are some of the suggestions that you received as a mom of a 3-year-old?
The number one thing people tell me are to talk to your child about it and start talking about how exciting it's going to be and making new friends and the activities that they're going to do and things like that, just to play it up in that child's eyes so when they do get to that first day of school, they have some expectations of what they can look forward to.
What are some emotions that the other parents have explained to you that you need to deal with or be prepared to deal with?
Definitely that separation anxiety that happens at the beginning of school. I have a mindset on it that yes, there's going to be some separation anxiety, but it's all good. It's a learning curve that she needs to go through to be able to learn how to be away from mom and be with friends and learn to follow the leader and take instructions and all those good things. So I'm not as worried about it. I think we'll get through it, but I think it's definitely something that as a 3-year-old, she needs to be prepared for.
And so have you taken her by the school or done any other things to prepare to separate from you that first day?
Yeah, we've gone together to buy her school supplies and her uniforms and things like that, and we talk about it then, and she sees her school, it's right around the corner from our house, and so just that daily interaction, we talk about it's happening soon and what to look forward to and what she can be excited about. So I think that it'll be scary for her at first, but I think that she's going to end up loving it in the end.
And what do you do if she cries every day, or how long do you let that go on for before you seek assistance?
I've told that most of the time is harder for the parent, so I'm going to be prepared for that. The teachers have said that usually it lasts less than 5 minutes after mom and dad leaves, and so the parent thinks about it all day until you pick your child up again, but your child's just often playing as soon as you're out the door.
Now, do you recommend any kind of checklist to prepare the parent and the child before they go to school?
Absolutely. There are a lot of checklists out there. You can Google it. You can print off any. Schools most of the time have some for you, but things that you need to have or things that you need to do as far as immunizations go, the school supplies, what fees and registrations have to be prepared. If you have other issues that need to be addressed with the school, such as allergies or special needs, make sure to jot all that down, because as it gets closer to school, you have more in your mind. You start worrying about that first day with your child. So think it through, think of everything that you need to have or be aware of, need the school to be aware of, so you can talk about that in that first orientation that parents do.
And you mentioned allergies. How important as a parent is it to make your school aware of your child's allergies?
Absolutely. My daughter has a peanut allergy, and so that's a severe allergy that she needs to have an EpiPen in her classroom at all times and things like that. So I've let her allergist know that she's starting school, and so he's had some paperwork that he's familiar with working with other children in that school. The school also has their own protocol that they have to follow. So I'm kind of learning about that system with the school, but it's definitely important to start talking about it up front. For an example of, you think about all of the medical aspects of things that need to be taken care of, the paperwork, having the EpiPen, things like that. But when I started talking about it with the school, we were able to place her in a classroom with children with other food allergies as well. So she'll be seated with them at lunchtime. There's no exclusions, sitting by herself, feeling isolated or separated. So the school is aware of that and able to address it. So that emotional issue will also be taken care of.
Lindsay, you mentioned allergies and talking with your physician. What in particular did you have to do so that your child could have medications at school and at home? Because it's kind of like having 2 sets of medications.
And there's 2 sets of policies as well. The school has paperwork that they need completed, that the teachers know how to follow, the dosage and things like that. The allergist also has forms that he had and ready to go with the medical instructions and things like that. So both sets of paperwork need to be completed for both allergists and the school. And so getting that taken care of is important. But it's all about what your child's needed. So when you're looking at schools, even if you're not ready there, your child's going to start in a year or 2, make sure you understand the allergy policy at the school that you're looking at. Some schools are more flexible than others. Some schools don't allow medications in the classroom, like the EpiPens, kind of those things that you need to be aware of before you place your child in that school.
And so you really do have to prepare, whether your child's on EpiPen or like an inhaler for asthma, you really do need to prepare and talk with your doctor and talk with the different schools to see which school would meet your child's needs.
Absolutely. They all have different policies, so you just need to make sure you find the one that can help your child and address that child's needs.
Lindsay, is there anything else you'd like to share with us about starting your child at its first school?
There's so many ideas out there on Pinterest that if you're getting ready to start school, look up first day of school on Pinterest. There's lots of ways to capture those photos and those memories so your child can look back later and see all those first days of school happening. So definitely check that out too if you're getting ready to start school.
Lindsay, I understand you have a blog for new parents. Can you tell me a little bit about that?
Sure. I started blogging right after my daughter was born as more of a diary or a way to express all those emotions that you have right as a first-time parent. You're not sure if they're normal or if they're abnormal. You're self-diagnosing yourself on WebMD, which is not good. And so basically I just started putting out there kind of what I was learning as a parent, my thoughts and emotions, and people started responding back and saying, no, that's totally normal. You're fine. And so after that, I liked it so much and the response that I was getting, I just kind of chronicled our journey of more of us learning to be parents, my husband and I, and then the experiences that we go through with our toddler. And so that's opened a lot of doors for us as far as being able to share resources with other parents or learning from our experiences of what not to do. That's been helpful as well. So we get great feedback about the things that are very average and everyday stories that we're telling on the blog.
And how do we find your blog?
Crawfishtales.com, and Tales is Tales.
Okay. Well, thanks for sharing this valuable information as a parent with our viewing audience today.
Thanks for having me.
And we will be right back with more Community Health Heroes.
Packers.
Vikings. Red State. Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
Storms come up fast. Take time for storm protection now. Reinforce your roof. Make sure you're adequately insured. Shutter windows and other openings. Elevate your home if you live in a low-lying area. To learn more about how you can protect your family and property from storms, visit getagameplan.org and click on Mitigation Plan. Louisiana, we can do this. This mitigation message brought to you by the Governor's Office of Homeland Security and Emergency Preparedness.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you once again for joining us. If you would like to suggest a health topic or send information on your health organization's events, please visit our Facebook page or email us at communityhealthheroes@gmail.com. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.